Hello, I'm here today to talk to you about a story that my daughter and I experienced in the spring of 2015 regarding an infestation of head lice. Each year, her school will send out letters regarding head lice infestations if anything happens. And every time we check and nothing's ever happened. However, in the spring of 2015, on her second last day of school, I received a call saying, "You need to come pick your daughter up because we found a nit in the back of her head." So off to the pharmacy I went and I grabbed some RNC shampoo and picked her up from school and we did the treatment. We sanitized the house and while her treatment was setting, but little did I know that the next 2 months is going to be filled with daily house sanitizations, daily head combing, and multiple treatments. I chose this topic for 3 reasons. 1, I relate to this topic due to the major infestation, spring of 2015. 2, the countless hours spent combing, picking, sanitizing, and multiple treatments. And 3, the alternatives that I tried and ones that worked best for us. There are 3 variations of pediculosis. First, there is Pediculus humanus corporis, that's the body louse. Then you have second, the Pediculus humanus corporis, that's body louse. And third is the Pithyrus pubis pubic louse or crab louse. The most common louse is head louse. Head lice are considered ectoparasites because they live on the exterior of the human body or on the scalp. Head lice will receive their nourishments from the host via feeding on human blood about 5 times per day. When you think about it, that's absolutely gross. Throughout their feeding process, they inject their digestive juices into the skin, which causes the scalp to become itchy. Have you guys ever heard that people scratch their heads because that's the eggs hatching?
No.
Yeah.
Well, that's a myth. It's like a mosquito bite. They inject juices into the skin, making it itchy. For a mosquito, your skin will become inflamed. Usually on your scalp, you'll actually have a sore, an open sore. It doesn't usually get inflamed. When female louse lays her eggs, they lay the eggs close to the scalp. They are firmly attached to the hair shaft with a tenacious substance. These young lice will hatch in roughly 10 days and will reach maturity in 2 weeks. So these are 2 pictures of adult live lice.
They look scary.
Yeah.
Yeah, they're scary. I had them living in my head.
We had lots. And this is the picture of the nit, and then you'll see the tenacious substance that
I had
actually...
them living in my head too.
Young lice are typically found at the base of the head in the back behind the ears. They prefer warm, dark areas on the head, making it harder to locate the live lice because they move quickly towards the darker sections from the partition area. You'll be able to see the eggs nits on the shafts of the hair quite easily. They're oval, grayish, whitish in color, but they're sometimes harder to get off the shaft of the hair. So using a fine-tooth comb, so this is what you will get in like a NYX or RNC shampoo. This is what we used to actually partition her hair. However, most times you'll use your fingernails because the egg is really stuck to the hair shaft. As I mentioned before, the live lice feed off their host. Often these bites will result in open sores on the scalp, which need to be monitored because they can become infected quite easily. Children are at higher risk for lice infestation. It can be easily transmitted, and because the children are often very touchy and feely, they tend to want to share things and clothing items without thinking about the risks of sharing bugs. Lice can be transmitted directly by physical contact or indirectly, such as sharing an infested comb, brush, hat, bedding, so on and so forth. As you may know, there are several brands of chemical treatment that you can purchase over the counter at any pharmacy. These medicated shampoos have lindane or pyrethrin compounds and piperonel butoxide. These shampoos are, in my opinion, toxic. They have an awful smell and usually hurt your eyes when applying. So it's always best practice to keep your child's eyes closed during the washing and rinsing part of the treatment. With these shampoos, you will lather it into the hair and thoroughly throughout the scalp and the hair shafts. Once you have a good lather, you will rinse all the chemical out of the hair. Normally, you will part the hair into sections, and within those sections comb through the smaller sections, removing any nits and or live lice you encounter. Continue this until the whole head has been looked through, and this will occur daily for a few weeks normally. So I'm going to tell you about the story that happened to us. So in May of 2015, the school that Brooklyn had sent out a newsletter saying there was a confirmed case of head lice, and we were to check our child's head. Each family is required to check so the infection doesn't spread. I had looked through her hair and didn't find anything of the sorts. It was probably about 6 weeks after, on Brooklyn's second last day of class, I received a call to come pick her up because they had seen the nit. In a mass. They were in the mass in the gymnasium, so was it on the bus?
Yes, it was on the
Well,
bus.
I'm pretty sure the teacher said it was.
No,
Anyways.
it was getting off the bus.
Okay, so
I
it was.
showed the teacher.
Okay.
Well, actually, Kit showed the teacher.
So anyways, now we've cleared that up. Right away, I was in sheer panic because I've never had to deal with this. I mean, my mom did when I was younger, but that's a different story. I didn't have to do it.
Yeah.
So I went out and I purchased, like I said, the RNC shampoo, and I treated her hair. Brooklyn was mortified, and like any normal child, was upset because of the last day of schools were happening, and she wasn't able to attend until after treatment. We did the first treatment, combed and picked for several hours that afternoon on the front porch. Thank goodness it was nice out. After I treated her, I bagged items and that couldn't be washed and threw everything into the washer. I did a thorough clean of my entire house. If you can imagine the countless hours that process took alone. Brooke did attend her last day of school, and she was a happy camper. We continued to do daily combing and picking. Near the end of the second week from the first treatment, I felt overwhelmed because of the number of nits and live lice I was pulling from her hair. So I decided another treatment with RNC shampoo was necessary. So we repeated the whole process again with shampooing and washing and disinfecting the entire house. Again, several hours spent doing this procedure. Now by week 3, I was feeling itchy. So I called my mom, and she came over and checked my head for any nits or lice, and yes, she found some. Nothing compared to Brooke, though. I proceeded with a treatment for myself, and my mom combed and picked through my hair for me while I did Brooklyn's hair. This was a daily occurrence for about 7.5 weeks. The treatment is awful. It smells gross, stings the eyes, and for Brooke it stung her scalp when applied, right? Yeah. I decided to further my research, and I asked some coworkers what they had used, if they had heard of anything other than the chemical treatments used for treating head lice. I had one person say that when their children were young, they found that part vinegar and part mineral oil mixed together worked well. The mineral oil was used for suffocation for the live lice, and the vinegar affected the nits. Another person suggested coconut oil. Live lice don't like the smell of coconut and would suffocate. And that also is like used for suffocation. Yeah, you can. Thank you.
It's wet.
And another person suggested tea tree oil. Using normal shampoo and putting some in with the shampoo because lice don't like the smell of tea tree oil. You can also buy the tea tree oil within a shampoo as well now. Sure. First, I tried the mineral oil and vinegar mixed on Brooke's head. However, she was in a lot of pain. The vinegar stung her open sores on her head, and she had tons. Like, it was all over her head. She was in tears, so we quickly rinsed that from her head and scalp and re-washed it with regular shampoo. I felt so bad for my girl. I tried the coconut oil next. That was much nicer. No pain, and it relieved some pain for her. So we lathered the coconut oil deep into her hair and scalp, and we let it sit for an hour. That seemed to help slow the little buggers down, for sure. It smelled so much nicer than the RNC shampoo and the first alternative treatment I tried. Since the spring of 2015, I have incorporated the use of coconut oil treatments to our hair a minimum of once a month. I do it to mine. she does tea tree oil. Although Brooke doesn't partake in this, she, like I said, does the tea tree oil shampoo at least twice a month. Should be. I want to explain how I managed to comb and pick daily successfully. I would part Brooklyn's hair into smaller sections, so usually I would do one here and about one here, and then two in the back. Sometimes two and then one at the base of her head. And within those smaller sections, I would use plastic clips to clip them off, or elastic bands that I was able to just toss out after I wasn't going to reuse anything. And I would make smaller sections within those sections to remove any live lice, and I used my fingernails to remove all knit seam. It was quite the process. However, I became really good at it. By the end of our crazy 8 weeks of daily combing and picking, entire household disinfectation, and multiple treatments, we managed to get rid of all the little buggers. Brooke and I were relieved, and I can only imagine my mom was relieved, because in all that time she was coming daily for at least 5 weeks, combing and picking through my hair. So far, we haven't had any head lice, and I'm hopeful that we will not have it again if we follow proper methods to prevent the spread of head lice. Thank you for partaking in my video presentation. I have evaluation forms that need to be filled out.
Mom, I remember when I was asking when it's done.